I'm Christi Deaton. I'm Florence Nightingale Foundation Professor of Clinical Nursing Research at the University of Cambridge. And with me is Professor Miguel Mendes, who is Professor of Cardiology at West Lisbon Hospital Center and also at Nova University. And we're going to talk about how to exercise patients with cardiovascular disease, a question that is very important. So Miguel, what I'd like to put to you is we've just finished a session with the experts talking about this topic. What was the most important message that you got from this session?
Well, we were challenged by very difficult cases, 3 difficult cases. And what was more important for me is that the presenters were able to find an appropriate program for each patient. And the cases at the beginning were, many of them, at the threshold of being rejected or not accepted for a program, but it was possible to include them and having some benefits by the participation in the program. That was very rewarding for me, that saying, yes, we can, yes. Instead of, oh, it's better not to do. So many times we must say, yes, we can, and do the trying with the patients. Did you think what you thought about that?
I agree, yes. I think we're often faced with patients who are very complex, yes. And we think that, well, we could do this or not, and it would be easier not to, but it's overcoming those challenges, and I agree, that was very important.
We must be positive. I think we must be positive with the challenges that real life brings us every day with difficult cases.
And that patients can benefit despite these problems.
That's true.
That's right. One of the things that they kept bringing out, though, is that we can exercise patients, we can do the training as part of cardiac rehabilitation, but then cardiac rehabilitation ends. And the issue is we want patients to continue to be physically active. We may have gotten them to a state where they're able to do that, but they're no longer in a supported program. So what's the key to keeping patients active?
Well, I think that the first thing is the patients must perceive that exercise is good for them and that they do it well. Only something that you feel that you do well, that you can do well, is sustainable on a long term. If during the program the patients don't enjoy what they are asked to do, of course at the end, or probably even before the end of the program, they will stop doing it. So if they perceive that what they do is good for them, that they enjoy, and this is very important, crucial for us, to ask the patients things, intensities and modalities that can be performed by them. If we ask them impossible things, very technical things equal from one to the others, it will not fit that particular patient, and that particular patient will not enjoy to do what he can do, because we can ask something at an old lady of 70s and another thing for a guy with 40. It must be a different approach. And I think that another secret is to keep them in touch with the program after leaving the program. Ask them, invite them to come every month, every 2 weeks, on the long term, just to see talk with the people, ask them what they are doing, and try to keep their enthusiasm on the physical activity. I think that this long-term approach, this follow-up, is very important for them.
I would agree. What I heard was about giving people choices, the exercises they want to do, as you just mentioned, the issue about then following them up and providing some additional support. So we've talked about that many of these patients are complex. So why is it so important that we persist with patients who have multiple reasons not to exercise?
Well, that's maybe the difference between having or not quality of life, being or not able to have an independent life, because exercise can promote that, and that makes a full difference in patients' lives and even in the relation that they can have with the caregivers. If they think that they were taught for something that was good for their life, they also will adhere on other measures that may seem not so interesting for them at the beginning, but they say, this guy, this team has good things, good choices for me. I'm with them, and they are helping me to be more successful, more healthy, and with all my limitations.
Yes.
And I think that this is very important.
Thank you. So in summary, what we've heard is the importance of exercising patients, and that despite a number of problems and comorbidities, that most patients will be able to exercise, and that we can find strategies to overcome these difficulties. So I would like to thank Miguel and the session that we just had for their expertise and for this program.